And I call on the member for O'Connor.
Thank you, Deputy Speaker. And I rise today to draw the House's attention to the NDIS travel policy changes and the impact on regional and remote electorates like my own. Around the middle of June, I started to get a lot of communication from NDIS providers who were very concerned about this change that was coming at them from the 1st of July and how it would impact on their patients. So what has happened is that the NDIA has reduced travel labour that can be claimed to 50% of the standard hourly rate. They have maintained the existing time limits of 30 minutes each way in the modified Monash areas 1 to 3, 60 minutes in Monash areas 4 to 5, and continued the no limit in areas 6 to 7. Now, what this actually means on the ground for the providers, but more importantly, the recipients of these services, is that, for example, in a town like Albany, where a service provider was travelling to Katanning, which is an hour and 3/4 to get there and an hour and 3/4 to get back, previously they were absorbing the lack of payment for the 45 minutes because they were capped at an hour. They were absorbing that and they were continuing to travel beyond the 1 hour to provide the service in a town which has limited service providers. I have been told by those providers that they will no longer be able to viably provide those services, which means that people in a reasonably significant sized regional town in my electorate will no longer have access to particularly these allied health services. And that story is repeated across the electorate, across many of the 100 towns that I represent. Now, the peak bodies have complained that there was a lack of engagement, a lack of consultation prior to these changes being brought in, and there was only 14 days' notice given to the service providers to make whatever changes they needed to make to adjust when they came in on the 1st of July. One would have thought that when making decisions around service provision to remote and regional communities, the providers based in Albany, Esperance, Kalgoorlie would have been consulted to get their view on how this would impact. But I haven't been able to find anybody yet who was consulted by the NDIA on these changes. So the NDIA's annual pricing review says that they needed to address excessive claims and that the current arrangements can lead to travel claims that are higher than the value of the support, especially in regional or less populated areas. Well, yeah, that's absolutely right. If you live in Warburton, which is 1,000 kilometres north of Kalgoorlie, then yes, the travel is going to cost more than your actual service, but that is just the way it is. If the NDIA have a better solution, then they should put it on the table, but I will come to the impact that it's going to have on that particular community in a moment. So what the service providers that I've spoken to are calling for is the reinstatement of full travel rates on regional and remote services, a genuine consultation with regional providers and communities, and a 3-month pause on changes until the regional impact is addressed. Now, I mentioned the situation with the Nunundara lands, and one of the service providers who travels out, well, the only service provider, in fact, who travels out to Warburton to provide these services, not just Warburton, there are many communities surrounding Warburton, has given me a case study that she'd like me to present to the House. And this is the impact of the travel cuts on an amputee client in the Nunundara lands, and she goes on to share. So I'd like to share the story of a participant living in the Nunundara lands, an Aboriginal woman in her mid-50s who recently underwent a below-knee amputation due to complications arising from unmanaged type 2 diabetes. In her case, early intervention and health literacy supports were not accessible, contributing directly to the progression of her condition. There is no regular podiatry or diabetes education service available in her community. By the time she presented to hospital, her condition had deteriorated to the point requiring surgical amputation. She now requires significant support to regain independence and avoid further decline. This is where the NDIS-funded occupational therapy becomes critical. Our team, one of the few mobile OT services willing and equipped to travel to the NG lands, is working with her to restore function, dignity and safety and safe access to her community and home environment. Without face-to-face, culturally responsive OT input, here's what she would go without. An appropriate wheelchair prescription and fitting to allow basic mobility and access to essential daily activities, e.g. using the bathroom, getting food, attending cultural gatherings. Urgent home modifications such as ramps, grab rails and bathroom alterations to prevent falls and further injury. Functional assessments to support hospital discharge and determine the supports needed to live safely at home. Coordination with prosthetic providers, which requires OT involvement to support the transition to a prosthetic limb over time. Self-management training focused on activities of daily living, pressure care and secondary prevention of further amputations and infections, and liaison with community supports, family carers and health service to create a wraparound care plan and ensure cultural safety. Now that's a pretty extensive list that this particular client will go without. And there's no question that this service can be continued under the current rules. Her nearest regional centre is over 1,000 kilometres away in Kalgoorlie, meaning service delivery requires up to 22 hours of round-trip travel per therapist, often over several days, until the 30th of June 2025. NDIS travel rules allowed providers to claim this in full time, making the service possible if still tight financially. However, from the 1st of July, travel to these communities has been kept at 50% of what our total hours, regardless of distance, duration or number of therapists involved. This results in an estimated loss of 20 plus hours of unfunded travel time per therapist per outreach trip, which makes it financially unviable. So the consequences of this are clear, Deputy Speaker. She may not receive the equipment, training or home modifications needed for her to return home safely. She may face extended hospitalisation or be placed in aged care at a far greater cost to the system and to her cultural, emotional well-being. A prosthetic may never be viable without appropriate pre- and post-rehab OT involvement, and there are no locally based therapists to take over. The telehealth is not an option due to limited connectivity, language and cultural barriers. So this is just one example, and I have, I do thank very sincerely the service providers across the goldfields, not only for what they do on a daily basis, but also for providing me with a whole host of case studies, which I'm not going to get a chance to get through in the time available. But so, Deputy Speaker, in conclusion, I did want to say that the decision to reduce NDIS travel funding to 50% of the service rate creates a significant barrier to the service provision for families in regional areas, and particularly in my electorate of O'Connor. Physiotherapist from Collie, the other end of the electorate, says his grave concerns regarding the National Disability Insurance Agency's decision to lower price limits and travel funding for physiotherapy supports. Physiotherapy services under these new pricing limits are unsustainable and will dramatically reduce choice and control for vulnerable NDIS participants. New rate cuts and further reduced funding for clinician travel do not keep pace with growing operational costs required to provide individualised care. This will have an even greater impact on participants in rural and regional settings. So, Deputy Speaker, as I say in conclusion, what this all adds up to is a situation where people living in regional and rural Australia will receive a significantly lower level of care than their city cousins, and that is simply not fair. And I call on the government and the Minister, who I've written to, and to her credit, she has responded, but responded by saying there'll be no change, to revisit this, to take into account the impact of those people who live outside the box, and we're not talking about millions and millions of recipients here. We're talking about, probably the people mostly impacted in my electorate would be in the hundreds, if not the low thousands. So it's not a matter of destroying the budget by making and accommodating this small group of people who will be impacted. It's simply about providing equity and fairness for people who live in regional and remote Australia. Thank you.
Thank you.